afternoon, everyone, and welcome to our Difficult Conversation series. Today, we are very privileged to have a wonderful volunteer with the Alzheimer's Association of Oregon talking today about dementia conversations. Please welcome Tiffany Hodges as she shares with us her knowledge and her skills on how we can be better at communicating.
Okay, so today we're going to be talking about dementia conversations, driving doctor's visits, legal and financial planning. And, this is something I wish I would have had access to for not only my mother, but my father-in-law. That's the reason I became a volunteer, is because my life has been significantly impacted with dementia. And so, this is a great opportunity for learning, and we have some resources at the end of the program that you can either go onto the web or you can call us. You can be a volunteer. So there's a lot of opportunities to get information. So some of the most difficult conversations are going to the doctor, deciding when it's necessary to stop driving, and making legal and financial plans to cover care needs. So today's program will provide tips on how to break the ice, have the most common difficult conversations, help you plan ahead, and build a care team that communicates well, give you the opportunity to hear from people who are dealing with similar issues, and connect you with helpful resources. So we've got all these different things. My sister lives close and she can help. She's always been fiercely independent, and if I step in, she'll be offended. We're starting to notice changes. We're not sure that there's even a problem. You're busy with your own life. I'm fine. Don't worry about me. Wait till you're my age. Things are harder than they used to be. I think we've all probably heard those. So successful conversations. Sooner is better than later. Don't wait for a crisis. Develop a plan for using finesse. Take notes about the changes you see. And this is really important. So, if you're a family member or, friend, caregiver, it's really important to have kind of a timeline for the doctor, your primary caregiver or primary provider, to know what to look for. Has it been 6 months? Has it been a year? Has it just been a couple weeks? And if you keep a journal of, if they're starting to misplace things, if they're having difficulty recalling, certain names, or kind of word finding, like, I know what that is, and they just can't recall it. Those are things that are important. If they need more help than they used to, as far as maybe they don't remember where the closet is or where the bathroom is. Those are all things that are going to be important pieces of information for your doctor to know. So practice in advance. This is part of what this is, getting some of the information and tips that we're going to give you, and to practice those before you need to use them. And then talk when you're both relaxed and comfortable. It just makes for a better conversation. Your mood is going to set the tone for the mood for the person that you're talking to if they do have dementia. So conversations about going to the doctor. So sometimes there's fear, there's anger, sometimes there's a stigma. Like, if I go to the doctor, they're gonna say this about everybody because I'm old. It could be that they're upset about a diagnosis. Are they having checkups? And then you can get medical help. So, how do we have this conversation to where it's nice and calm, and be able to get them into the doctor? So Donna knows the importance of talking about getting help. So we're going to listen to a video that Donna is going to discuss.
I think you have to be honest. I think that's the important thing with it. To get a loved one to the doctor, I think you just need to be candid and honest of what are you trying to do. We're trying to understand what we're up against. It's just so important to do that, because you can't battle something that you don't know what you're battling. Again, it may not have been Alzheimer's, it could have been depression, it could have been so many other things. And guess what? There's other things you can do to take care of those issues as well. But that's what you need to be able to do. You can't ignore something, it's not going to go away.
And I think that's important. So, like she said, there are other things it can be besides, a form of dementia. And when we say dementia, dementia is really a blanket term for having some type of a cognitive issue. So there's different kinds of dementia. There's Alzheimer's, there's vascular dementia, Lewy body, Parkinson's has some traits to that as well. And so it's really important for your doctor to know um, what you're seeing because they present differently. So tips to help with the conversation going to the doctor: use words that are most comfortable for that person. So sometimes I'm a nurse, and sometimes people are like, when you come to see my mom or dad, you're Dr. Tiffany. Well, okay, that's fine. If that makes them more comfortable, I will kind of go along with what makes them comfortable. Or maybe they really want to just see, I want to see my nurse, and the doctor might come in for a short time. You can use, and if they have a long-term care provider, that typically is something that they're more comfortable. You might see a little bit more resistance if it's a brand new doctor. Suggest that Medicare is free and there's an annual wellness visit. So, a lot of times people are, I'm tight on money, I can't really afford this, but with Medicare, that wellness visit is covered. Pair an enjoyable outing with the doctor's visit. I don't know anybody who really enjoys going to the doctor. So, hey mom, hey dad, we're gonna go out for lunch, and then afterwards we have an appointment. Or you could go to the appointment and then follow it up with ice cream or pie or something, because that way they're not leaving the doctor in a bad mood, or they're not going to the doctor in a bad mood. And you might pair it to where maybe you're going out for coffee before going to the doctor, and then maybe you're going out for ice cream or a slice of pie afterwards, just to kind of take some of that negativity away. Invite family to communicate concerns and questions to the doctors. Not knowing what's going on is very scary. So having a list of questions to be able to communicate, concerns for the family members is going to be something that'll be helpful. And then, if still reluctant, try using a therapeutic fib. So, sometimes you have to get kind of creative with this and say, we're going to go see Jenna, and Jenna could be the doctor or the nurse. And, maybe you're just having to use something a little bit more creative. We're going to go there. I need to go see the doctor. And so I thought, since we were going, you're coming with me, that you could see this person. So conversations about when to stop driving. Have you noticed car accidents, traffic tickets, scrapes on the car, and making mistakes while driving? And we're going to click on here to see what Chris's family needed to ask father to stop driving here.
There's no exact answer on this is when you stop driving. You could tell when coming up to an intersection, as an example, the ability to understand what's going on around you was starting to deteriorate a little bit. Being on the highway with cars on both sides becomes a little bit more difficult. And first and foremost, the safety of everybody in the car, as well as other drivers on the road. You think about that, and you want to make sure you're not putting anybody in danger. But then the difficult part is telling your dad, who you love, and he loves driving, and he's used to it, that he can no longer do that. But then even then, taking the keys away full time was very difficult. The doctor was very helpful in just saying, medically, you can't do this anymore. But my mother had the hardest time with this because she knew how much this was going to hurt him as well. And this is one of the first things that we had to deal with as a family when it came to telling my dad that he had to stop doing something because of this disease. That meant a lot to him.
And what I like about what he talked about there is that he brought the doctor into that. It's very hard for a child or a family member to sometimes not, say, I'm taking the keys away. But then you have a doctor who most of the time our loved ones respect and really value their opinions. So sometimes it's easier to have that conversation with the doctor and have it come from them, because then we're not really portrayed as the one who's doing it. There are pamphlets at the local DMV that can help guide you on this as well. And it is very hard. So the other thing to remember too is when someone has dementia, they lose all of the peripheral vision around them. So that's why they said, look for scrapes on the car, because all of this peripheral vision is now narrowing in, and your vision goes from losing all of this to going to monocular eventually. So, if you go up behind someone and you grab their shoulders, a lot of times you see them kind of jolt like this, and that's because they can't sense or see you because of that peripheral vision being gone. So plan ahead before an accident occurs. Express your concern about specific changes you've noticed. Appeal to the person's sense of responsibility and concern for others. So, do they have grandkids in the car, or could they possibly, be hitting somebody that has children or a young family in the car? Here we've got Sheila, who had to address the issue of driving with her father.
Some tips on having the conversation is pointing out, especially for my father, the potential danger to others that it may cause if he's behind the wheel. And, just talking about it from the standpoint that this is not only the best thing for you, but this is also the best thing for others around you. And these are some of the alternatives, making sure that, this is what's going to happen, having a plan. If mom can't take you, then Uncle Thomas or will be here to take you, and we will make sure that you're getting out of the house and that you're doing some things. So, presenting the bad news, but then also presenting the plan. And for my father, that's really, really important to have a plan.
And like that she said, that they have a plan in place. So, what other family member that they, get along with or enjoy seeing can take them to that doctor's visit or appointment that can make or break someone wanting to go or not. So offer alternate plans for transportation, and incorporate the voice of an esteemed professional and have empathy. So here Wendy recommends using empathy to help with the conversation.
Talking to somebody about stopping driving, I think it's most important to understand that that is tied to someone's independence more than most things. And so by saying you can't do this anymore is like telling the person, it's like ripping away their independence. And that doesn't feel good for anybody. I know that I've always tried to put myself in that situation. What would I think if someone was saying this to me? You don't get to do this anymore. And how would I feel? And how would I want somebody to talk to me about this? And so if you try to I think sometimes too many people try to approach it as, very punitive. And I'm doing what's right for you. So why don't you understand, without really turning the tables and putting themselves in that position, understanding, how helpless that feels to take those things away. It's important to be thoughtful about what that experience is like for the individual.
And I think that's especially true especially if the person did a lot of driving in their career, or if Sunday drives were really important. What ways can you still incorporate? It may not be them driving, but can we still incorporate some activities to still allow them to have those drives and visits? So when to stop driving, maximizing independence, options, choices, and planning, and legal and financial planning. So we've got Chris's family member who's dealing with the financial costs of Alzheimer's and dementia.
Financially, this disease will increase the cost of living. It's just a fact. So planning for those extra costs is that much more important than what you were planning for before. And so you have to review everything that's in place, see what changes needed to be made, both legally and financially, and you have to monitor that going forward afterwards too.
So part of what he may be talking about and we may be covering could be, if there's a power of attorney that's needing to be appointed for both health and for financial. There's guardianship that would need to be looked at if, depending on where in the process of the dementia prognosis they are. And then, there's different things that you might have to look at, in-home caregivers, versus a memory care community. What kind of things do you need to do to your home if you're going to keep them in their home? Security system, or some type of alarms or bells or something that you can hear if they're opening or closing doors. So there's just a lot of different aspects that need to be discussed and talked about. So conversations about legal and financial planning, you may feel reluctant, you may feel uncomfortable, you may feel intrusive and disrespectful. So we need to talk about it. So we've got Julie, who gives advice to friends who have anxiety about the financial conversation.
Here's what I've come to after all of this. That it's the most loving and kind thing you can do for them is to be honest with them and say, this is like a really scary thing. And I feel a lot of discomfort bringing this up to you, but I tell them, if you're going to be the one who's going to take them on this journey, then you have to tell them, I'm going to be here on this journey with you. And there are things that we have to do to get this in place. We're going to go on this journey together. I've told you I'm going to be here with you till the end, so let's get this ready. It's like we're going to go on an ocean ship. We've got to get things packed up. We've got to figure out what we're taking with us. We got to get ready. And the things that we have to get ready, we have to make sure that we know which doctors you're going to be using. I need to get this signed, okay, so that if you go in there and they have to do surgery, for example, I got to have this durable power of attorney for health care for you. I have to have this worked out, okay? Now, if for some reason, okay, you need to go to rehab after something, I have to have these documents here, the financial stuff, so I can get these things taken care of for you while this is going on. I don't want to have anything get in the way of us being able to progress and keep doing this. I said, it seems hard because it's hard in our heads. Everybody's read about people who've stolen from elderly people, who've done these horrible things. But if you're the person who's approaching this with loving kindness and compassion, and you're willing to take this person on this journey, you're not doing a bad thing. You're doing the right thing by talking to them about it. And you approach it from the standpoint of, I'm here for you. I'm doing this for you. We're going to do this together. And I'm going to help you through this. And these are the tools that I need to make sure that we can do this.
And what I liked about what Julie discussed there is that, it's something that needs to be done, but also if you can get it done while the person still can be involved, I think is really important. Do they want to be buried? Do they want to have a cremation? Do they want a celebration of life, or do they just want to have something quiet at the house? How do they want to keep going back and forth to the hospital, or are they going to be DNR, which means do not resuscitate, don't do CPR, just let me go naturally? Or do they want like a limited amount of treatment? Getting that input as soon as the person's diagnosed, and again, you may not catch it in the very beginning, but if you can catch it while they're still able to help plan the rest of their future, we want to give them as much say and input as we possibly can, so that their wishes are being honored. And again, we're the ones who are able to change. Unfortunately, this disease, it takes over, and it just diminishes the brain capacity to make certain decisions. And so we're the ones who are able to make those decisions. So very important to involve and keep that choice as much available as possible. And, if you attend some of our other classes that we provide, it does talk about how we can give you more information about offering choice, even clear up until the end. So tips to help with the conversation for legal and financial planning. So begin by explaining that you are in this together. Start by asking questions and gathering documents. And it's really important if they have a safe to know what the combination and how to work this safe, because I personally have run into that, and we ended up having to have a locksmith come out. And all it was is that that particular safe turned a different way than the traditional ones do. So very important to have, is there a key to a certain desk, or is there a combination to a lock? What are your wishes? How do you want things planned out? Do you still want to have access? Do you have a post? And a post is a bright pink piece of paper that really does the down and dirty of, are you DNR? Are you having CPR? And then it goes through comfort measures only, limited interventions, and full treatment. And that's something that is signed by the patient or the power of attorney or relative, depending on what your status is, and then signed by your doctor. And that's something that a lot of people keep on their refrigerator, so that if by chance the paramedics are called and they wanted to do whatever intervention, if it says DNR and do not resuscitate, they're not going to do anything. But if that form is not there and they don't see it, they are required to do full treatment. So just something else to think about. I explained that these are standard plans that need to be made as we get older. Break the conversation into parts and try different times and locations. So if they're not a morning person, don't talk to them about this in the morning. Or if you start to notice what we call sundowning, where things are kind of flip-flop, then you might want to look at, well, mom's okay to talk to till about 2 o'clock in the afternoon. After that, she's kind of confused. So, look at the best time of day, maybe after you had a meal, they're comfortable, they're well rested, and, just try to make it a good conversation in the best time. And then involve others as needed. I know personally, my brother and I are the ones who are taking care of, things for our mother, but we do ask for help from our siblings, for going to the grocery store and picking up different items if one of us is on vacation or on call. So, reach out to people that you can trust and that are going to be able to fill in the gap for when you or your other half is not able to do that. So the care team, so you've got your family, you've got your medical team, you've got peers, you've got your workplace, and you've got community resources. So you can contact us. We have the Alzheimer's Navigator, so you can go to alz.org. We have the Community Resource Finder. That helps you find pretty much anything that you need related to, is there any type of respite available? Is there any, and what respite is if you need a break. So do you need someone to come in for X amount of time, whether it's hours or a day or a week, that can fulfill that. And right now that might be challenging due to COVID. Just to let you know, we can help find different facilities, make recommendations on in-home caregivers. So it can be a really great source of information. We've got the Alzheimer's and Dementia Care Center, the Safety Center, and the big one here is our 800 number, which is available 24 hours a day, 7 days a week. That can be in the middle of the night if you're at home and you're like, I don't know what else to do right now. I've tried everything that normally works, and what do I do? And you're going to be talking to someone that is a trained specialist to do this, that will give you information and suggestions. And then if you're in any of the 50 states, we have chapters all over the country. So if you're visiting someone on vacation and you say, gosh, you guys could really use a Zoom class like this, let's see what you have. You can go and find more support groups, education programs, and it's all throughout the 50 states. And then if you want to do any type of training, we have the training.alz.org, and that's free online educations. So you can get involved. We just had our walk on 10/10/20, and we had to do it differently this year because of COVID and the pandemic going on, but we still did it, and we still raised a lot of money so that we can find a cure for this disease. So we'll be having another one next year, and we don't know what that'll look like just yet, but we'll do what we need to do to have that happen. We have the longest day, which is June 21st, because that's the longest day of the year, but every day for someone that has dementia can be the longest day. So marketers and nurses and CNAs, a bunch of us in the community get together and go and visit memory care facilities here locally. We take necklaces and balloons and goodies out for them so that they know that they're loved, and we sing to them and just make a whole day of letting them know that they matter and they care, and we care about them in our community. You can volunteer. You don't have to teach classes like I do. There's a lot of other ways that you can volunteer. So if that's something you're interested, reach out to our local branch. You can we advocate. We go to Washington. I personally have not gone, but we do have representatives that go and ask for funding and ask for what kind of research we can have for this disease. And then another way you can be active here locally is do the Alzheimer's Association trial match. And that's if we have a trial here in the area, they need people that are healthy and people that are affected with varying levels of dementia to join. And that's something that they can contact you through email to set up. So remember, no one can provide all of the support alone. Form a care team and talk about these things with your family's concerns as they arise, but you have to talk about it. Again, here's our helpline, which again is 24 hours a day, 7 days a week. And it is a wonderful, caring person that you're going to hear on the other end who can certainly empathize with what you're going through. So please take advantage of that number. Well, I'd like to thank everybody for watching our class. I'm sure that we'll have more. Sounds like Dodie is going to be having quite a few series going on for whatever interest you have. So we are happy to come back and do this yet again. And feel free to reach out to us with any questions after you watch this video. Thanks for joining us, and we'll look forward to hearing from you soon.